CMI Fertility Live Facebook, Sundays 8 p.m. to 9 p.m. Although there's a little bit of a chat out there that this is a bad time and something earlier may be better. But, I've learned that somehow we can't make everyone happy in this, but we're trying our darndest. I think Sunday evening is always a good time before our rest time. And I've had a steak and a little bit of Dr. Rob Kiltz. Reconnect. There we go. And I'm assuming we've all got it, but this thing is always working to connect and reconnect. And let's get us going in the right area. And I hope you're listening and inviting. And we're just going to be patient in this. Hey, Will, how you doing? And thanks, Will, for helping support our Facebook Live. And we're always here to answer questions and listen and learn all together. And we're working continually having a IVF giveaway. And who got the last IVF giveaway, Will? It was Nikki. And don't forget Carissa and Brian. And they're on Instagram. And we're working to get this all out on Instagram. And really just continue to share it in every best way we can. Let me get to the live part of where we're at here. And again, Jasmine, Jennifer, Sharonda, Jess, always the best, Quebec, and let us know where you're coming from. And just keep on sharing. And if you have ways of helping others out with knowledge, experience, medications, eggs, embryos, and we're really boosting the donation of embryos that a couple is not, or an individual is no longer using. The more we can share and be supportive of others that need those embryos, need those eggs, need the sperm, need the affordable fertility care, and we're standing strong to the $3,900 IVF and payment plans, and really working to make it more affordable, and recognize that many people have coverage for IUI, their medications. Don't forget about laparoscopies for endometriosis, and there's a lot of silent endometriosis. And one of the things that I think is what I'm focusing more and more on, the recognition that inflammation, that sort of big heading, the causes of all of our problems, and obviously we're talking about infertility, repetitive pregnancy loss, failed implantation, that's early and late losses, are all due to inflammation. And there are a multitude of causes of inflammation. My general belief, it's the food we're eating, it's that keto that is really helping so many. And look at Maria Emmerich's stuff, MariaMindBodyHealth.com. And Kiltz's keto is extreme for sure. There's a lot of evidence that by going keto and reducing inflammation, so many are having spontaneous pregnancies and staying pregnant. And when I go back over 10 years ago, my patients were getting pregnant and teaching me about a change in diet, food, and I learned more about it with paleo diet, and then I've since gone to keto. And again, I'm really very supportive of what Maria is doing, so give Maria Emmerich a shout out because she needs our support in what she's doing, and send it to your friends and your family. And I've seen diabetes, hypertension, high cholesterol, everything go away, irritable bowel, colitis, and of course, fertility rejuvenated. And one of the interesting things, and Heather, Jenny, Tara, Lisa, Lacab, and again, if I pronounce anyone's name incorrectly, please forgive me. But so much of what we're learning is that we can turn it around in a way that none of us ever imagined. And again, this wasn't anything we doctors, healthcare professionals learn anything about food, but the more and more I practice it, the more and more I'm amazed. And let's take our first question, because you know I can talk and talk and talk. But endometriosis. Carissa, thank you very much. Any help with endometriosis? Well, my opinion is endometriosis is another intra-abdominal pelvic inflammatory disorder, likely contributed by the food we eat, the environment we live in, the stress. And so by, in some way, realizing that endometriosis is a cause even when you don't have any symptoms of pain, discomfort, bleeding, or any previous history, the only way to know is to look inside with the laparoscopy. And so often you could look inside and you can visualize either chronic inflammation, hypervascularity, scar tissue, or the characteristic powder blue spots, which quite often it's just a sign of a little bit, but it may be more globally than we imagine. And by excising it, vaporizing it, cauterizing it, there's lots of different conversations about the best way to get rid of it. And my bet is that, in my experience, all ways work. Sometimes you have to do a more pelvic peritoneal resection or just some localized resection. So the only way sometimes is to look inside, laparoscopy, and at the same time you can excise it, vaporize it, or cauterize it depending on the depth, the extent, and the location. So it does help tremendously. And again, endometriosis is a silent cause. It's just another generalized intra-abdominal pelvic inflammatory condition. And let's get to, hey Lisa, how you doing? Why do some embryos need to be cultured out to day 7, and are the chances of implantation lower? Well, day 5 and 6 embryo blasts are the ones that we've gone to the most, and we believe that they're better, but more and more we're looking towards even day 7 embryos and blasts, and they can be a normal pregnancy also. So often our science is behind us and we come up with these opinions, only blasts are valuable. Well, that's not true, because even cleavage stage embryos, so day 2 and day 3 are cleavage stage, and day 4. But any embryo put in a uterus at least is given the opportunity of becoming a baby. And so some people, I had a lengthy discussion about day 7 embryos and wanting to throw them out because they're no good, because someone heard that other people throw them out, they never freeze them. But more and more we're having the internal discussions and we're seeing the success. So if you were an embryo on day 7 and all you thought about as a doctor is that you'll never make it and you were thrown out, well, never a baby. But we give every single embryo a chance. We do not screen who can come to us. Your numbers don't matter, although we will modulate the treatment, higher doses, lower doses, priming protocols. But day 7 embryos can be babies, day 6s, day 5s, day 4s, day 3s, day 2s. And we used to transfer them in day 1 and 2, but we're capable of culturing them longer today. And so the stories aren't always so clear when you're reading them on Dr. Google, but Dr. Google can be very helpful. Hey Tara, how you doing? And La Caba, K, we have 18 5-day blasts frozen, and we'll be donating the majority of them after successful transfer. So grateful. Remember, we're really pushing life and gifting to others. And our genetic material is from an infinite number of us that come before us. And we're all really genetically almost the same. The environment, both mental and our physical environment where we live, and most of all what Dr. K says is, what do we eat? That makes the most value. But share it around. Our words in this global CNY fertility Facebook village is, how can I help you? And really the foundation that I've started this over 20 years ago, affordability, quality, access, and turn no one away. It doesn't matter your size, your AMH, your FSH, or your previous failures. Again, we're going to do our best to give you your probability, But remember, no one can say it will or won't work. We're not that smart. And so the best way to get something is always to do something. Hey, Ashley, Anastasia, could fertility treatments push you into early menopause? That's really a good one that we don't know for sure. Because when we're stimulating ovulation with all these medications, we're stimulating the release of more eggs. But the theory here is that there's a cohort of eggs that are ready each month or each time frame that are coming up, and typically they would be lost and degenerate and then die, but that one follicle is making it on average each month. It doesn't appear that we're pushing things into early menopause. I believe that our environment that we live in, with the high inflammation within our bodies, high glucose, glycation, high plant antigens, phytochemicals, and fermentation in our bodies, and excess exercise. And I'm working on a new story to send out to everyone. And if you haven't checked out my TEDx talk, so just go to TEDx, Dr. Rob Kiltz. I did a story on the human Ferrari, but the more we work out, the more inflammation in our belly, which is our core. And I believe that's really the key to early menopause, and we're creating it due to microvascular inflammation, interstitial, that means between the cells, the inflammation, and then within the cells, the inflammation, and all that is trashing our ovaries and our testes and making our eggs and sperm just die off prematurely. Interesting story. Hey Ruth, how you doing? And listen, I know everyone is so patient. The whole idea to these conversations is that if you don't have a physical or a phone consult until months away, you can begin to hear the story and listen more and share it, and really ask your village mates in the CMI Fertility Village, what did you do? How can I prepare? How can I work on my paleo, keto, lowering inflammation, yoga, meditation, prayer? Remember the vision board, right? Put the picture of you, your partner, your family, and that which you dream about. And that's how it really comes true. So we're excited, Ruth. Hi, Jennifer. Let's see. Best protocol for first time doing IVF. Well, we want to make the first time the best time. And so much of what we're looking at is the woman's age, height and weight, AMH and FSH, and getting an idea based on those whether you do a standard protocol. So a standard AMH, not PCOS, not diminished ovarian reserve, is going to be on average about 300 units of gonadotropins, about 10 days of gonadotropins, and an HCG Lupron trigger. I have generally been recommending a freeze-all cycle and going either to the cleavage stage or the blastocyst stage, and then doing a modified immune protocol. You don't have to be super aggressive, but depending on the history, and recommending transferring one good blast or up to 2 day threes, but it depends on your age. Less than 35, we're really pushing for one. And everyone should be looking at Theralogics, Ovasitol for men and women, Inositol, which lowers glucose and insulin levels and lowers inflammation. The Ovavite, which has the vitamin D and the methylfolate and the CoQ10, and then low dose naltrexone. And you could Google some of these things, and this will be shared time and time and time again. And the low dose naltrexone, or LDN, is an opiate agonist antagonist at between 3 and 4.5 milligrams a day. It is a magic pill that lowers inflammation. And look at the movie The Magic Pill, which talks about ketogenic diet. And I'm going to use that label, but basically it's a high-fat, low-carb. And everyone should be sharing that concept. And remember, whether you're a vegan, a vegetarian, a standard, a Mediterranean, a paleo, or a keto, or Kiltz's keto, which is like, I call it the carnivore of the Lion King plan, There are ways to go keto and anti-inflammation. And we're just seeing such an amazing change. You should be sharing this with your entire family, your friends who are suffering from every disease you know. And infertility is just another disease, an inflammatory process. And so the best protocol is going to be individualized. But if you have a lower AMH, you're going to want to do a higher dose, 450 to 600, potentially prime with human growth hormone and DHEA. And then if you're in the PCOS range, well, keto is king. And then Ovasitol, I think, is better than metformin. But any of these that are the treatment for the pre-diabetic, and much of what I believe is we're all just pre-diabetic metabolic syndrome, and we're doing our very best to slow it down. Spread your meals apart. I call it intermittent feasting. 1 meal to 2 meals a day, 12 to 24 hours. Not in an 8-hour window. I mean, you can eat a tremendous amount in that 8-hour window. In the meal once a day, you can actually have a little more carbs, although you didn't really hear that from me. But as a vegan vegetarian, you really want to cook them down, add the fat, coconut fat, buttercream, and as a vegetarian, add the egg. Those really help in the process. And Tanya cooking Maria's recipe for dinner while listening. And again, send out the accolades to Maria and thank her. But I've learned from Gary Taubes, from Anders Sienfeld, from Jimmy Moore, from so many out there on this ketogenic journey. Edith Davis, and again, look at our website, and we're working on our ketogenic process. But remember, we get caught up in the words, but we gotta just let go of the words. And what we're doing here is trying to change the fuel for your Ferrari. Remember, the most valuable and expensive and irreplaceable being of the universe. And hey, Jamie, Heath, a pleasure. 27 weeks, first transfer. And you know, we really work to make it the one time, but you really have to be positive, persistent in the process. And the more we can do that, the better. And the more each of us could share the story with someone. And we have so many that get pregnant just because they heard about us and shared the story. And we know that there are so many great fertility doctors out there, OBGYN doctors, family docs, and I think all of us are really working to coordinate and help. And Eastern medicine and Western medicine, we're really not at odds. We really fit nicely. Be open to all of them, by the way. And part of the immune protocols, intralipids, which is an infusion of fat, Lovenox, prednisone, either Prograf or Plaquenil, IVIG, LIT therapy, leukocyte immunotransfusion. These are some kind of things that I thought, no way is this stuff going to help you. But I've been so amazed at how it does for so many people. And that's without IVF, because CNY fertility is really about how can I share some ideas that I've learned from you guys in so many ways, LDN, the immune stuff, and really we've learned from Beer, Braverman, Kwok Kim, Dr. KK, and so many others. We're all on the learning journey together, and the more we share these ideas, the more open we can be. And don't forget, acupuncture, massage, touch, meditation, visualization, light therapy, the list goes on and on and on. Stephanie, go keto, absolutely, 10 weeks. Keep keto in pregnancy. And so fat is the fuel always. We don't go from glucose to fat. We always burn acetyl-CoA that is constantly being shoved into the mitochondria from triglycerides and fat. That's it. Our liver makes fat from carbs and protein all day, all night. And stay keto when you're pregnant. And when you're having nausea and vomiting and you can't eat anything, don't. Your body is saying, protect me from all those plant antigens, those plant phytochemicals. It is rocking amazing. And again, it really works. And Dr. Ditkoff, Dr. Grossman, Dr. Corley, just amazing docs. We all have slightly different approaches, but from each of us, you get their beautiful energy that we're all here to share. And Jennifer and Chris in Buffalo, and Lee and Katie in Rochester, and Grace and Meg and Kelly in Syracuse, and we're all there. And my Albany team rocks, my Syracuse team rocks, and Rochester and Buffalo really all working together. But between Dr. Faruqi in Montreal, so many people out there, and we're really a pleasure. And let's see here, don't forget, let's see, Linda B., how does Menopure help with egg quality? All right, well, Menopure adds both the FSH and the LH, and this LH component comes from HCG. And so there's some evidence that Menopure only may be better in some people, but nowadays we're using Gol or Follistim with some HCG, low dose, which provides the LH, which seems to help in preparing the egg for making a great embryo and implantation. So that's what we think. And we love Dr. Royo, who's going to be leaving me, and we're so grateful to his help and energy. And Tara, thanks for shouting that out. And we're so grateful. We are here to help everyone use their eggs and sperm first, help modify and shift and change, and keto really does help in this whole process. And so keto, DHEA, human growth hormone, so powerful. And I think even laparoscopy, hysteroscopy seems to help tremendously in excising or vaporizing endometriosis, or removing a bad fallopian tube where you have chronic inflammation. The seeds of inflammation are hard to get rid of. And so we're doing a 30-day antibiotic regimen, Doxy, Cleocin, or Z-Pak, and it really does help in the process. Check out Theralogics and use the code 113205, and you'll get a discount for your product. And I'm really, again, both the male side and the female side, it's Conception XR for the guys and Ovavite for the gals, and then the Ovacitol for both. The Theralogics, Theromegas, which is omega-3 fatty acids, can be really helpful. But if you're not using Theralogic, there are a lot of good products out there in the process. And Jessica, how you doing? My AMH came back at 5.05. So an AMH greater than 1 is fantastic. As you get up above 4, 5, and 6, it typically may be related to metabolic syndrome, or PCOS, polycystic ovarian syndrome. It usually means a greater ovarian reserve. And so this is really where the high fat and low to no carb diet comes in. This is where the Ovacitol or the metformin comes in. And it's not about weight loss, but it's about changing the internal inflammatory environment. That's really so critical in the process. By doing that, it'll change your environment. So many people are having keto babies, and it's happening more and more and more. And someone said today that they talked to one of my clients, and they were sort of like, I've got to do this. And you don't have to do anything. It's just another idea in the process to help you in your pregnancy journey in building a family. And hey, Tara, how you doing? The scratch, okay. And recommend, yes. The scratch is an endometrial biopsy. It's like tilling the soil. It's clearing and debriding the tissue. Maybe it's removing the inflammatory tissue, helping neovascularization come through. It seems to be helping implantation and pregnancy rates. The endometrial receptivity assay or the endometrial biopsy may just be improved because you do that biopsy. Generally recommending it the cycle prior to implantation, but it may help for up to 3 months. You've all heard the stories of my friend had a D&C and then got pregnant, probably related to the same ways. And I do recommend it at any age. And if you're planning a fresh embryo transfer, we still do them, it's still possible. Then do the hysteroscopy D&C or the scratch endometrial biopsy the cycle prior, whether you're on estrogen, progesterone, or the birth control pill, or just in the luteal phase, the last week prior to your natural menstrual cycle, that's the best time. And we're really working with your OBGYN, your fertility doc all around the country, the world. They can help on this journey. We're really all working together and sharing, and we're so grateful for sharing in the whole journey. And hey, Melissa. Hey, Johnny, how you doing? Have done a day 3 freeze-all and not had anything thaw for use. We've never had any make it to freeze day 5, always done fresh. Oh, let's see. Have we ever done day 3 freeze? And absolutely. There are a lot of embryos that don't make it to blast because our culture conditions don't make it conducive for your embryos. And it may be a sperm issue, it may be a culture issue. It's not perfect. But I've seen so many that some centers only do blasts and then your embryos never make it in your uterus. But we've seen so many come to us. We do day 3 freeze-all and we do a frozen thawed cycle and we get success. And I can't tell you why, but I'm not here to tell you why. I'm just giving the story that it works. And again, our culture conditions used to not even be able to take them past day 3, but now we can make it better. And so if what you're doing isn't working, why do we keep doing it the same way? There is never one way to do anything. We're really sharing the idea and the journey that there's lots of ways, and that's what we're sharing. So if you failed blast, go to day 3, freeze all or fresh. But if the fresh isn't working, convert it to freeze all cycle. And it works really nicely. And you can still do an ERA, endobiopsy, and improve the process. All right. Hey, Kylie, how you doing? Planning IVF after October. It's our pleasure. And we're really just sending the thanks to everyone around the globe for supporting CNY Fertility. And just share it. Listen, we are learning. I've been working to be the most affordable fertility center in America for over 20 years. And I'm committed to that. And we have a great, amazing team. We'll continue to provide that. We're working on Dr. Verdalis in Atlanta. We're working on just a global approach. And approach your OBGYN doctor, your fertility doctor, and say, listen, I can't afford what you have here, but we need help to get to over here. And my bet is that we're actually building and helping so many people that can't afford those places to afford something. And ask about our full financing programs. And we're really here to help and assist in the journey. And ask about our add-on for donor eggs. And how to make, if you're a male factor, we work with a lot of couples that have male factor. We have a lot of ideas how to take care of the men in the process. The men need to look at keto paleo. They need to slow it down. They have to look at the supplements, look at yoga, massage, meditation, acupuncture. Slow it down, all of us. The racetrack is going to end up in the junkyard. And I know it just sounds completely crazy, but I've been doing it now at 62, no exercise in over 10 years, and I feel the very best. And we've seen so many of our men and women and our same-sex couples, our individual men and individual women who are seeking fertility have success when it just wasn't happening. And remember, it's quality and persistence and changing up that really, really, really matters. And I hope I've answered that question. And hey, Donna, just had my second failed IUI on Femara, fourth failed total, starting fifth one this week, and then back to second IVF with donor add-on. Not finding the right donor for us on your site. We work with all donor banks. We work with, if you have a family member or a friend, or if you find someone. We have a lot of new donors coming into the mix right now, and we're working to get them going. A lot of what we're working on is we have your sperm sample frozen either Albany or Syracuse, and you can have them frozen either in a Buffalo office or Rochester office or anywhere that then can be shipped to us. When we collect those fresh eggs, then you say, yes, that's what I want. We can help make those embryos and freeze them. And again, look towards your local donor program, but we work with any agency that will help you find the eggs that are right for you, like donor sperm agencies. They can ship the sperm eggs to us. We can thaw them and fertilize them with either donor sperm or partner sperm, and make it happen. So again, any and all donor sperm and egg banks we can work with, and we're here to help. And Megan, how you doing? How many carbs do you recommend for a keto diet? I know there are different grams of carbs, and I work to be as zero carb as possible. And yet, look at Maria's stuff. Look at Edith Davis's stuff. But really look at Maria Emmerich's stuff, and she has a lot to share. Our percent of carbs in our diet should be in the 5 to 10% range. Fat should be in the 70 to 80% range, and protein is pretty stable at about 20%. It's a hard one. I can't measure things. I don't weigh myself, throw it all away. And when you eat the 1 to 2 meals a day and spread them out, no seeds, no nuts, no pasta, no bread, no yogurt, no milk. I'm really working on another level, but Maria has some really great stuff that'll kind of help on that. Do you think, and Leslie H., how you doing? Do you think the Mediterranean diet is good for IVF? Okay, so Mediterranean is another good way to do it. But much of it is whatever diet you're doing, if you can eat one meal at night or morning and night and that is it, it'll really help tremendously in the process. So I hope that answers your question. But Kiltz's Keto, Lion King, Standard Keto, Paleo, Mediterranean, Standard American Diet, and you guys all know what that is. It's what's making us unhealthy. Vegetarian, then vegan, and again, all of those things have the potential to help you on this journey. You just have to look at different ways. I personally believe that fruits, fiber, and vegetables in excessive amounts are not good for us. Maybe any amounts are not good for us. And I know I share a very, very unique view, but I am amazed by the human Ferrari story, and it really does matter. But Mediterranean, listen, many couples will be successful if they don't do keto, paleo, or Mediterranean. It doesn't. Like we're here to take care of you, no matter which way you approach it. I'm just trying to give you a menu of ideas that may fit and feel right for you, that success comes either naturally, assistant IUI, or it's ready to do IVF, donor eggs, donor embryos, a gestational carrier, surrogacy, or adoption. So, Jessica, I have my consult in September. So excited. We're so grateful. Again, we're here to just kind of help make it happen. All the way from Oregon. We really appreciate that. Have heard nothing but amazing. And again, we're grateful for those amazing stories. AMH came back at 5.05. it's a good thing, it's better. Lower doses in general gonadotropin, so in the 150 to 225 range. Freeze-all cycles may be more helpful because you tend to have higher estrogen levels, more eggs, and maybe the endometrial environment might not be so good. But again, look at keto paleo in the process. Let's see. Hey, Christine. Jenny, my husband has CF. We have so many CF clients, and with cystic fibrosis, there's an azoospermia from absence of the vas, and we're capable of getting sperm out. And if you choose to select an embryo that is not a carrier or is not affected, we can do that. But if you're simply here to help make a baby, whatever the genetics are, we're here to help you on that journey also. There's been so much on PGS, PGTS, pre-implantation genetic testing, and aneuploidy, PGTA, where we can identify if those embryos seem to have a higher aneuploidy rate. There's this thing called mosaicism. There's a lot of controversy going on right now that we may not have 100% accuracy in these testing. That said, between grading of embryos and the PGTA testing, we may be able to better select the embryos for those transfers if you have a lot more embryos. But it does not answer, is it a good embryo that's going to make it or a bad embryo that's not going to make it? We can't answer that exactly. That's the biggest problem in this process. And again, thanks for continuing to share, to love and like, but send us your opinions, email them to Will, to myself. We are really, really, really grateful on this great journey. Riss B, how exactly does LDN help with adenomyosis? Currently doing Lupron shots every 6 to 8 weeks. Adenomyosis has shrunk 40% and will be done with the Lupron in September. So curious about the LDN and just super nervous about having another chemical failure because of adenomyosis. So remember, endometriosis, adenomyosis, uterine fibroids, inflammation in the pelvis, in the uterine environment is due to the fermentation, the high carb diet, a lack of eating fats, a 3 to 5 meals a day with seeds and nuts in between. I call it fake food. And low-dose naltrexone is an opiate agonist, antagonist, but Phil Boyle, if you look at Phil Boyle's stuff from Ireland, he's been doing it for a long time, and LDN seems to reduce inflammation. It's used for all amazing disease disorders. And remember, all the diseases that we have and suffer from are caused by, guess what? Inflammation. And so it will help with inflammation, massage, visualization, meditation, acupuncture, prayer, all these things come into being. Remember, start your day with a daily prayer, listening, journaling, and sharing. And so 3 to 6 months of Lupron, but it can come back if you keep practicing the old ways of too much activity, exercise, too much carbs, and not enough fat. So we can help with all of this. And Lisa, thank you for everyone's accolades out there. And remember, share the story and the journey. And if we've made mistakes, because we're all human and I apologize, we're all learning on the process. It's doing, getting. And the idea here is an error. You know, it's not mistakes to get to something. It's learning to do, learning from everyone. And today, Dr. Google is amazing. All of us can find more information than I ever could through medical school, residency, and fellowship fast. And so keep on sharing. And again, accolades and thanks to Will and everything he's doing. And Gia, how long do you typically prime for an FET when dealing with bad inflammation caused by PCOS, very high NKs, endo, 30-day keto, 30-day antibiotics, 30-day LDN, 30-day yoga, and check out Aaron McCullough's Yoga for Fertility through CNY Fertility. Wherever you live and wherever you're at, you can now link on to Aaron and bring some friends in. And again, isn't it amazing? We're all in the same living room together. I'm here at my lakefront home in Skinny Atlas, and finding the beauty of nature. So get out and take a walk. If you're going to get on a bike, go slow and easy. If you're going to go running, just make it a slow and easy jog. Listen, something positive, uplifting. Ovasitol, those are the things that'll help with PCOS and metabolic syndrome. Hey Jay, how you doing? We do get down and we lose hope. And how to find a positive little sparkle in the darkness of this process. Our emotions are driven down when we fail, and it doesn't seem that there's any light in the process. We each need to listen and learn and hug and hope. And the stories we share through the fail, positive, that's the thing to this journey for all of us together. And that's what I've learned, and that's why integrating Eastern and Western medicine is so powerful. Journal, listen. But when we get down, maybe sometimes that the energy is necessary to push us. You know, you can't always be positive. I know I try, I practice. My wife says, Mr. Positive. We got to find a light in the darkness. And the stories we read and listen to really help. And hypnosis. Where's the book over there, Will? It's right under the inflammation book there. I apologize. From under that. Yeah, both of those. And the stories, let's see. Okay, the stories are really critical. And when we read the stories of success, I know sometimes we don't want to go there. We don't want to read about others' success because it makes us feel down. But Lindsay Eastburn has shared some stories, and there's so many people that are on this journey together. But that's where Yoga for Fertility and our for fertility support groups come in, and you can listen to the stories. But don't give up, and have faith. And maybe I always say our foundation is spirituality and faith. In the failures, we find the path in one way or another. I hope that helped. And let's see here. Always good. And Kristen, live sessions for the yoga. Aaron's working on Facebook Live. And I think that's so critical for all of us, and coming from everywhere and anywhere. And again, local yoga, but I don't recommend the hot stuff. Cool it down, because when you heat up the gut, the core, you're just denaturing the DNA and the protein. That's not good. You're cooking your eggs, and we don't want fried eggs. We want fresh yolk. Remember, the fat and the yolk is where it's at in the process. But Erin, I'll have her put some stuff on with Will, and we're working to get more of the live yoga.
She's on every other Tuesday.
Every other Tuesday.
On the secret group.
On the secret group, and just send in emails and ask. And where do we send that to? Lisa. Send it to.
Facebook Messenger.
Facebook Messenger is a really great way through CMI Fertility, and Will and Aaron and everyone will connect. We got to get rid of the secret stuff here, because we really want to open up and share it in the process. But so many are afraid of sharing the story, and the truth shall set you free. And the more we're able to share the story, getting it off our chest makes us feel better in the process. And I'm so grateful for for just everyone doing that. And PGS required for MFI, Rosina, MFI, spell it out. That would be helpful for me. And then I can answer the question. So send it back. Angelique, how you doing? Time to introduce yourself. My husband, listen, for all those that come to Syracuse or Albany, we're all working our best to be out there for you guys, and be patient. And the front office staff is really working their very best, and we're on your side. If they're, hey, I didn't hear from anyone, let us know. We'll find the reason why that happened, because then we'll fix it. And so we want your experience to be the very best. And when we hear it from you, we can do that much better. Let's see. Oh, male factor and fertility. Thank you. Maybe I'm not the digital guy quite as much, and in the process, but PGS is not required for anything. And we do ICSI, intracytoplasmic sperm injection, pretty much for everyone. We think it does offer a better chance. Low count and motility, by the way, is helped keto, slow the guys down, right? Okay, a little bit of weights, a little bit of slow and easy. Remember, Tai Chi, yoga, meditation, prayer. And I'm telling you, it's amazing, the shift. But the prostate, the seminal vesicles, and the testes, and the varicose seals develop because of intra-abdominal pelvic inflammation and the robbing of the blood flow from the core. And I'll send out my new write-up that I've been working on, which shows a graph that when we exercise, the blood flow goes away from the brain, away from the core, the GI tract, the reproductive organs, and it goes away from the things we need for fertility, and it goes to the arms and the legs. Remember, we're not running away from a lion. We're not gladiators. Go slow. That's the amazing part to this. Hey, Jasmine, Neupogen. And we need to remind ourselves about GCSF, granulocyte colony stimulating factor, Neupogen, another growth factor that helps with egg production, function, and implantation. So it does help a lot. And help with implantation, got my positive. And we used to do a lot of intrauterine Neupogen. We're doing a lot more sub-Q, intrauterine HCG. If you're planning a fresh transfer, we're doing a lot of intrauterine HCG and intralipids at retrieval. If you're doing a freeze-all cycle, we still do the intralipids. We plan the immune protocol. And so we're really working to talk about it when you get in for the IVF. But, we forget that whether you're doing natural IUI or IVF or donor eggs or frozen eggs and a frozen embryo transfer, all of these modalities can be very, very, very helpful. Remember, the immune system trumps everything. And, it's cancer therapy is using immunotherapy all the time today. Infertility is that next area that we just need to wake up to realize that all these conditions are exactly the same. It's inflammation. The immune system is attacking our bodies. Autoimmune conditions are because we're putting foreign material, antigens, that are causing that reaction. And remember, bring the prayer group, the visualization, the spirit, the vibration of energy, just like it's electromagnetic signals. When we look at someone positive love and we hold that love, whether it's remotely or in that environment, that's what we all need to be sharing. And modern medicine has forgotten about it. But our foundation is faith. It starts here and it vibrates all over. So faith, food is fertility. And remember, don't forget about intimacy with your partner. Into me I see, because when we begin to interact within the cave, that's where fertility rocks for all of us. And again, we're all sharing love and the connection. And the more you share it with those you don't know, and we listen to the stories, it unfolds. Hey, Kimberly, it's so great. Becky and Bethany, is there a way to get Neupogen covered as a Crohn's patient? Now remember, Crohn's, irritable bowel colitis, inflammation, it's caused by fermentation of fiber, fruits, and vegetables. Limit them, simplify them, and maybe Neupogen, IVIG, by the way, is the gold standard platinum treatment. We're really working for about $2,000. We can get you an IVIG treatment, and we're really working on that. We've been working with Kings, with Freedom, with Integrity, with Cornerstone. But so many people are working to find their medications in ways that happens. And keep going at it. Hey, Carrie, how you doing? Miracle Twins. And remember, we're just the vessel through which the energy of that spiritual energy, the nature of the universe, some people God, spirit, all those things that we don't understand, we're just working together to bring what nature brings to all of us. First time success, first time success rate for IVF, block tubes, tube not removed, no hydro. So you're looking at about under 35, about a 40% delivery rate. 35 to 40, about a 20% on average. It kind of goes from 40 down to about 20, and then over 40, about 10 to 20%. But it depends. Some 45-year-olds make 20 eggs, and some 25-year-olds make 2. We're working to change the environment and help make it succeed. And remember, no one knows whether that cycle you're 0 or 100, but if you do nothing, you know where you're at. Hey, Melissa, Melanie, how you doing? Is there an age cutoff? Older uterus, no anomalies? No, there is not. Using donated embryos, had a 17-week miscarriage. Remember, immune system inflammation, we have to take care of it and cover it for everyone. ERA, pre-receptive with day 5 progesterone. You want to transfer most likely on day 6. Make sure you're treating the immune system. Make sure you're doing hysteroscopy, D&C, and consider laparoscopy for silent endo. And remember, silent C, which is the antibiotic treatment, probably is a lot of inflammation in the process. And how's everyone doing there? How are we doing for time, Will?
We're good. 8 minutes.
Okay, we got about 10 minutes. And remember, you could share this live. We're going to be putting this on YouTube, and it's on our See My Fertility. We're working to just share on Instagram. And the more we share, the more we keep this affordable and patience in the process. Remember, our job is, in whatever time you're waiting, do something to get yourself fertile and pregnant before then, because we see it happen. Johnny, have you ever heard or read Medical Medium? Insight or thoughts on, well, we're all medical mediums, right? And that's where hypnosis and prayer and visualization and our energy all together comes together. And I think that's what we're talking about, yes? Nakira, 12 weeks, awesome. And 41 years of age, and it's our pleasure all over the globe. We see people from South America, from Europe, from Africa, Australia, Canada, and we also do gender. If you're looking for that boy or girl, We're here to help. We're so hopeful, though, that if you don't get the one you want, you either use them or you pass them on. That's the way. Albany, again, our Albany team, and Justine and Rebecca, our nurse practitioner there, all really amazing. And Dr. Brandeis and just so many out there that have shared and sent our clients and worked with us. Alan J. and Jay Boltnick working with us in Buffalo, and just again really, really grateful. And Bethany, others, and read that keto can be dangerous for thyroid if you already have an issue. I'm not sure I believe that, and this term keto is so variable. It's hard to know the cause. I believe that if you really simplify and minimize the plant antigens, you'll likely find whatever thing is causing the inflammation. The thyroid gland is the most sensitive of our glands because everyone has thyroid dysfunction, hyper and hypo, and it really is, I believe, from our diet. You're allergic to something you're eating, and whether you're doing keto, paleo, or whatever, it's likely a plant antigen or a phytochemical. I don't know of anyone that's allergic to pure, real fat, butter, cream, tallow, lard. And that is energy our body burns, and that is it. We do not burn glucose. Glucose and amino acids must be converted in the liver via insulin to fat, or you're dead. And that simply is that. But I know there's a lot of now everyone's coming out against keto. Remember, the powers that be want to tell us that you got to eat a variety, and I believe that variety is deadly. One partner, no extra boyfriends or girlfriends on the side, that's deadly for all of us. Variety, not the spice, it's deadly. And I know from time to time, and everyone says these things are good for us. Who said? Remember, I'm just giving you my opinion. You don't have to follow my way, because we do always. We want to support you in what you need on this journey. 43, lining struggles to get triple line appearance, suspects adenomyosis, 3-month lupron suppression, hysteroscopy, laparoscopy, low dose naltrexone, full on, the immune protocol, diet. Maybe even we need to start looking at IVIG, Humira, and Plaquenil. We're going to treat us like we have an autoimmune disease, like arthritis or Crohn's. All of these are inflammatory conditions that we need to look towards the rheumatologist, the immunologist in this process. Endometriosis and adenomyosis, there's still success. It doesn't mean it can't or won't work. And when your uterus and eggs or sperm aren't working, look towards donor eggs, donor sperm, donor embryo, or a surrogate. We always need to look towards those areas. We're working with Mirabelle Verdalis in Atlanta and working to get PRP, platelet-rich plasma, which is autologous blood. We separate the platelets, we infuse them in the uterus. That may be helping with implantation, and we're working on getting the license in New York State to be able to do that. So be patient in the process. I've had IVF. Hi, Lisa H. How you doing? 44 years old, had my daughter. Just turned 51 in March, and my daughter will be 7 in October. Awesome. Don't give up at any age. None of us know the way, but you do something in order to get something. That's really the key. And when you're feeling down and depressed, seek out help, someone to confide in, to listen to the story, a therapist, massage, acupuncture, yoga. Yoga for fertility is about sharing the story in that small private group, but really it's a global group. And the more we all visualize for those of us that are hurting, and we're all hurting in one way or another, there's pain in the process. Ooh, McKinsey, any tips on injecting progesterone in oil and getting it not to leak? Well, once you inject it, hold it a moment and pull it straight out in a slight little bit of pressure, but a little bit of leakage out is okay. You can't stop it, unfortunately. We're really working, progesterone oil is a hard one. We really work towards the vaginal, oral, or more and more we're doing a natural cycle for a frozen, a trigger shot, so either natural trigger or letrozole clomid trigger, where maybe we're allowing and what we're doing is allowing the natural progesterone to go up and the estrogen, and we're working away from some of that. But the vaginal supplementation may help with reducing miscarriage, so you may want to be thinking about that, talking to us. And remember, if you're conceiving naturally and been on this infertility journey, we are here in the early pregnancy support. Intralipids, Lovenox, progesterone, weekly measurement of thyroid function, and we're seeing so much thyroid dysfunction, it's sometimes hard to keep up with. But we are really working to do that in the process. But sometimes some of those numbers don't come back for a day or two, so we need to step back and work, all of us, to not get too crazy. Let's see, Monica, send me an email, send it again, Kiltz at See My Fertility, or 315-416-9872. I get text messages, and again, I don't always get to them right away, and if somehow it gets lost, send it again. Persistence on the journey. Unfortunately, Dr. Arroyo's leaving the end of June, and we wish him well. We have loved him much and wish him on his journey very well. We have Dr. Ann Wold joining us September 1, and we're working on a couple other docs joining us, great practitioners. And again, we're all sharing and learning together in the process. Candidate for natural FET, if you have regular menstrual cycles and don't have any luteal phase defects or PCOS, you may be a good candidate. But sometimes it's, again, letrozole, clomid, natural, and a trigger shot, and we can help a lot that way. And Monica, remember, you guys, you're not, this is what we do, and we're grateful to be able to do this, and we're here, and keep sending it, share it locally, globally, and again, we see people from around the country, because currently IVF is not affordable for enough people, but also many are not open enough to some of these alternatives and integrative concepts, complementary, Eastern, Western. And remember, the immune system trumps everything, and food is the best way to get to healing. And remember, if it's not keto, it could be paleo, and there are lots of ways, whatever dietary experience, and sometimes it's just a conversation, keep the journal, that we can help maybe find something you're allergic to and you didn't even know it. And I think we're really working more and more on maybe we should be doing more allergy testing. If you have irritable bowel, colitis, bowel problems, previous appendectomy, or gallbladder removed, you're likely suffering from inflammation in the gastrointestinal tract. And egg retrieval tomorrow, and we're here. Just keep the positive. We never know what we're going to get, but we want to visualize and hold on to that. And let's see, Brenda, hey, Katie, we are really grateful to our Rochester team, our Albany team, our Buffalo team, our Syracuse team, our Montreal team, our coming Atlanta team, our global team. Remember, your OBGYN, wherever you live, can be part of our team because they're capable of helping us with drawing blood. We send through LabCorp, doing an ultrasound, and we're working to connect to make it more accessible and affordable to more. And again, the story quite often is, hey, I got pregnant on natural. CMI Fertility, Dr. K, Dr. G, Dr. Grossman, Dr. Ditkoff, Dr. Corley. Grateful to all of them. And remember, all of our nursing team, all of our support team, all of them together are there to help. And yes, I'm working on a connection in Atlanta, and be patient. And I'm working on a Boston team. And as we gather those in those areas where they can help us and a local doc can help us, voila, we have a local team. And for so many, 20,000 for an IVF cycle, we're really working on how can you do 4 to 6, be persistent, make a monthly payment over 3 to 5 years, to make it more affordable and accessible for more people. And, again, this is the challenge. And medicine has lost its way. We went into medicine. I went into medicine. I had a sister with diabetes, Maria. I felt her pain. I've learned so much how we can change the story together and take medicine to a grassroots caring, and really through Google, through Facebook, through Instagram, through a whole different story. Yoga, acupuncture, massage, light therapy, such great energy that we're all sharing. So what changes a fresh transfer to a frozen transfer? So typically, if your progesterone level is above 1.5 to 2 on the day of trigger, if you have excessive amount of eggs, you have a endometrial lining that looks inhospitable, and it may mean it's lost its trilaminar shape, or we're not sure if there's a polyp or a fibroid, or you failed other cycles fresh, it's time freeze-all, endometrial scratch, hysteroscopy, immune protocol, and a freeze-all cycle with or without pre-implantation genetic testing, which is aneuploidy testing. And so really it's if it's not working the way you're doing it, that's the question, what can we do differently? Hey, Zandra, how you doing? And if I haven't said hello to everyone that's here, please forgive me. I'm so grateful from the global, the Philippines, Australia, Lebanon, Italy, South Africa, Kenya, everywhere in this world. And I'm so grateful. And it's time. And we're grateful again. We look forward to seeing all of you in one way or another. And if you're successful, share your success. Because when others get a chance to read your story, whether it was you just did it again or you thought about the process, this is the key. And Susan, gallbladder, keep keto, colectomy. Oh man, it is hard. Yes to keto. Look at Marie Emmerich's stuff, and God bless to everyone. And we'll see you next Sunday at 8. Yes. And if you have some other times, we're working on it. We'll share some different approaches. God bless to everyone. Dr. Rob Kiltz.